the Secretary to the Government of the Federation, honorable ministers here present, our permanent secretaries, directors and directors general, ladies and gentlemen of the press. Yesterday, the 13th of May, 2020, 184 new cases of COVID-19 were recorded in 22 states. A breakdown of the cases by states shows Lagos 51, Jigawa 23, Bauchi 16, Katsina 16, Kano 14, FCT 10, Rivers 10, Kwara 9, Delta 5, Kaduna 5, Sokoto 4, Oyo 4, Kebbi 3, Nasarawa 3, Osun 3, Ondo 2, Ebonyi 1, Edo 1, Enugu 1, Anambra 1, Plateau, Niger 1 each. 6 fatalities were recorded in the same period, bringing to 4,000 the total number of cases in the country to 4,971 on record, confirmed in Nigeria, with sadly a total of 164 fatalities. So far, 1,071 patients have been treated and discharged. As we inch towards significant milestones in our COVID-19 statistics, we are looking at all options to adjust our approach to the emerging situation. The Federal Ministry of Health and its agencies, particularly the Nigeria Center for Disease Control and the Nigeria National Primary Healthcare Development Agency, have scaled up training in infection prevention and control, case finding, case management, emergency patient transportation systems, surveillance outbreak response management analysis system, known as SOMAS, all the way down to training of hygienists, stretcher bearers, security personnel, and all others you will find manning isolation and treatment centers. This will increase confidence in the health system, reduce incidents of infection, and also reduce instances of desertion and improve overall performance. We have also deployed commodities like personal protective equipment and other supplies to the states and to federal health institutions, and in addition continued with supplies to laboratories to forestall the much reported delays arising from shortages. These measures and others are to address the needs reported to us by the Federal Ministry of Health team presently deployed in Kano, which has also paid exploratory visits to Jigawa, Bauchi, and Katsina, and is preparing to visit Sokoto and Borno very soon. Part of the needs already identified is the urgent necessity of on-site laboratories with molecular diagnostic capacity to reduce the presently extended turnaround time for results. Practical hand-holding personnel training has also been requested for some of the health systems who have had little experience in the past with infectious disease management. To this end, more personnel is to be deployed from the Federal Infectious Disease Hospital in Irua, while the kind offer of Lagos and the Ekiti State governors will also be drawn upon to send experienced health workers to assist. Step-down training will be a priority in the entire exercise to build capacity down to the level of community health workers in a bid to sustain safe and comprehensive delivery of COVID-19 services. The Federal Ministries of Health and the Federal Capital Territory held a ministerial meeting today and agreed on a firm synergistic collaboration and cooperation framework to respond to the challenges of COVID-19 in the Federal Capital Territory. A joint committee led by the Honorable Minister of State for Health and including the permanent secretaries of both ministries was created to oversee the newly donated This Day Dome treatment facility. The initial medical team is to be headed by the Chief Medical Director of Federal Teaching Hospital, IRWA, and his team, and the training regimen will be instituted to build the capacities of workers there. We also paid an inspection visit to the 600-bed COVID-19 treatment center at Idu, a flagship project of the Federal Capital Territory. Also slated for special emphasis is the delivery of routine service in all our hospitals in the country. Latest statistics from the National Health Management Information System indicates that outpatient visit has dropped from 4 million to about 2 million, antenatal visits from 1.3 million to 655,000, skilled bed attendance from 158,000 to less than 99,000, while immunization services has dropped to about half. All these have as yet undetermined consequences, which the easing of the lockdown should hopefully address. As you all know, we have insisted on sending members from Family Health Department and also asking Primary Healthcare Department, Primary Healthcare Development Agency to accompany the mission in Kano in order to stir up and activate routine services, which has been going on very well. However, the downside of easing the restrictions in the country needs to be balanced off by all citizens with a collective determination by all of us, not only to comply with protective and prophylactic advisories, but to encourage relatives, friends, neighbors, and customers to do the same. The use of facial covers like masks in places where social distancing may be difficult or impractical should be supported by all of us and emphasized through donation of masks to the population as an act of goodwill. Face masks should become commonplace, and I look forward to seeing cooks and food vendors, for example, wearing masks or risk losing customers. I wish to enjoin workplaces to also institute such requirements and ensure that all workers are masked and knowledgeable about COVID-19, and by extension, to share with their families and relations. We must realize that the wearing of masks is not an alternative, but a supportive initiative, and it is a least that we can do to protect ourselves and our opponents. Also, while on face-to-face communication, your mask needs not be removed. Otherwise, the purpose is defeated. I wish to use this opportunity to thank traditional, religious, and community leaders who have supported the mask-wearing initiative by ensuring that their subjects use masks as a minimum form of self-protection. The present rate of community transmission makes these measures and other similar measures to be helpful. We shall encourage state commissioners of health and their staff through the information technology platform to continue training and retraining their health workers in their states as more information of COVID-19 is received, to ensure that learnings and exchange of ideas and experiences from other countries is shared. We have been in discussions with multinationals and developing partners such as the World Health Organization and Global Fund, who help us in planning our needs and our processes and our procurements. Funds are also being repurposed for use in further increasing our diagnostic capacity and providing personal protective equipment for our health workers. I shall conclude by thanking all governors for their leadership they are showing in response to this virus, and also our citizens for adhering to public health advisories. The visit to Cross River State will be scheduled as soon as we can arrange the transport, and also to Kogi State as soon as details are worked out. I thank you all for your attention.